Medical devices, biometric monitoring devices, Lesson 5, Invasive blood pressure, IBP. This unit covers the basics of medical devices. The goal for this lesson is to understand blood pressure monitoring and to learn about the invasive measurement method. This is the content of this lesson. Invasive blood pressure, IBP, is measured from a catheter implanted in the body and converted to an electrical signal outside the body. The advantage of IBP is that it can measure blood pressure continuously and is able to capture sudden changes in blood pressure. Also, unlike an IBP, it can measure low pressure in the venous system. The disadvantage of IBP is that the tip of the catheter is implanted directly into the blood vessel, making it invasive and not easy to be measured. The catheter for IBP is implanted in the radial artery, dorsalis pedis artery, or femoral artery. The blood flowing out of the catheter is quantified by a pressure transducer. One thing to keep in mind when taking measurements is to keep the pressure transducer aligned with the height of the patient's right atrium. The table summarizes the error factors and countermeasures for IBP measurement. If the position of the transducer is higher than the right atrium, the value will be displayed lower, and if the position is lower, the value will be displayed higher. Also, if the 0 point is off, the value will be off by that amount. The waveform will be dulled if there are bubbles in or around the tip of a catheter. This is the end of Lesson 5, Invasive blood pressure, IBP. Make sure you've mastered the basics before you move on to the next level.